Well, tonight in medical rounds, it's almost that time, back to school, and that also means sports activities are kicking into high gear. But before your child takes to the field, you should keep in potential injuries, especially concussions. And joining us live now is Dr. Subramani Sitharama, Medical Director of the Hartford Hospital Rehabilitation Network, with important information and advice for all parents of athletes. Good evening, Dr. Sitharama. Thanks for being with us tonight.
Thanks for having me.
Well, first let's talk about what a concussion is and what causes a concussion.
So a concussion comes from the word cogitere, which means severe shaking of the brain and the skull, leading to a process of cascade of events that make the cell, damage the brain cell. And what happens is the brain cell now is starved, it starts repairing itself, and it promotes symptoms like headaches, dizziness, blurred vision, balance problems, fogginess, and that's what you see on the field, a dazed look on the face.
You speak
what
of that.
Causes a
Go ahead. I'm sorry.
What causes a concussion? The most important thing to note is a direct hit can cause a concussion, or an indirect hit can cause a concussion, like somebody hits a player and they fall backwards and hit their head on the ground. That itself can cause a concussion. So contact sports like football, hockey, lacrosse, soccer, you have a higher incidence of concussions.
Tell us, Dr. Sitharama, about the Concussion Clinic that you have there.
So the important thing, Denise, is we have done this for almost 12 to 13 years, and we have improved the access, because I mainly work with high school kids and pre-adolescent kids. These are parents who are working every day. Their kids are trying to get to school. So we try to provide access and a comprehensive management of the kids with concussions. Usually we see the kids within 3 to 5 days after a concussion. You allow the kid to rest for about 3 days. And then we do a full analysis, physical examination. We have a vestibular therapist in the clinic who will evaluate the patient immediately. And now we can categorize concussions. That's the big change in the way we diagnose and treat concussions nowadays. So we have cognitive fatigue concussions, we have vestibular concussions, ocular concussions, and based on what we find, we can provide the treatments the kid needs and get them back to school as soon as possible.
That sounds very encouraging and hopeful, and we thank you so much, Dr. Sitharama, for sharing such important information for parents. I guess when in doubt, get it checked out. And if you'd like to learn more, you can call the number on your screen for more information.